to the initiate breastfeeding. Regarding to the breastfeeding, it is important for the midwife to instruct the woman about the importance and advantage of breastfeeding for herself and her baby. Regarding to the baby, increase the immunity through immunological properties that help prevent infection. Also provide nutritional needs, either easily digested by the baby. Calcium is better absorbed. Less allergic food for the infant. Also promote development for facial muscles and jaw and teeth through the suckling of the baby. Less likely to be overfed and decrease the chance of obesity. Has a natural laxative effect. Finally, fulfilling the psychological needs by increased bonding between the mother and her baby. Regarding to the importance and advantages of the breastfeeding for the woman, the oxytocin released that aids in uterine involution and uterine contraction, as the oxytocin has a contractility effect on the uterus. Also a strong mother-infant relationship, which is called bonding between a mother and her baby. Convenient يعني متاح. It is always available and need no preparation. Cost effective. Less incidence of breast cancer during lactation. Natural contraception. As we know, during lactation, prolactin level is increased. That decreases the ovulation and decreases the chance for pregnancy or conception. Regarding to the proper positioning, during the first 8 hours after labor, the mother is allowed to sleep in any comfortable position. After that, prone position أو النوم على البطن or either lateral position should be encouraged in order to facilitate involution and help drainage of lochia. Also, sitting position is also recommended since it promotes contraction and of the abdominal muscles and also aid pelvic circulation and help with drainage of lochia. Regarding to the ambulation or movement, it is important to encourage early ambulation to prevent blood stasis and deep venous thrombosis. Also, heavy activities are avoided to prevent complication, as during delivery and pregnancy there is weakness in the muscles or generalized weakness in the muscle, especially in pelvic floor muscles, that lead to increased risk of genital prolapse اللي هو السقوط في الأعضاء التناسلية، بيخليها أكتر عرضة نتيجة الويكنس بتاع المسلز، فمش طبيعي أو مش المفروض إن هي تعمل heavy activities. Regarding to the nursing rule of promote bladder and bowel function. Regarding to the bladder, voiding should be encouraged within 6 to 8 hours after labor. If no urine is passed after 12 hours, initial simple nursing measures to induce the voiding as we speak later. If failed, catheterization under complete aseptic technique is performed. Regarding to the bowel, there may be no bowel action for a double or 2 days after delivery because the bowel has probably been emptied or evacuated during labor. So glycerine suppositories may be used to relieve the constipation. Regarding to the postnatal exercise, it is important to encourage postpartum exercise which promotes circulation, also lessen or decrease the possibility of venous thrombosis and restore the muscle tone and increase the strength of the muscles, especially abdominal and pelvic floor muscles. Also, postnatal exercise help to give the patient a sense of well-being, but certain patients such as heart disease should ask a medical advice to take a genital exercise because hard or vigorous exercise it is harmful for those patients. This is a very important exercise postpartum, which is called pelvic floor muscle exercise or Kegel exercise. It is important to strengthen the weaknesses that occur in pelvic floor muscles, which is important to maintain the genital organs and prevent genital prolapse, and also important to increase the strength of the urethral muscles and the anal muscles that prevent stress urinary incontinence and fecal incontinence. يعني ايه الكلام دوت؟ يعني اللي هي البلفيك فلور muscles دي بتحيط كذا حاجة. اولا around اليوريثرا، around الفاجينا، around الانس. فلو في ويكنس فيهم هتأدي لي اليورينري سيمبتومز، هتأدي لي للجي اي تي سيمبتومز، هتأدي لي الجينيتال برولابس اللي هو السقوط في الاعضاء التناسليه. فانا بالتالي لما بعمل الاكسرسايز دي اللي هي البلفيك فلور ماسلز اكسرسايز او الكيجل اكسرسايز، انا بقوي العضلات دي، فبالتالي بمنع المشاكل اللي ممكن تحصل اللي هي اليورينري سيمبتومز او الفيكال انكونتيننس او الجينيتال برولابس. ودي الطريقه او التكنيك بتاعهم. After explaining the early needs of the mother, we speak about the late need of the mother. The first need is health education and counseling. The midwife nurse play an important role as a health educator and counselor, which should provide the women with health education and counseling about some topics such as breastfeeding that include importance, technique, and position of breastfeeding. Also resuming sexual relation that include information about when to expect menstruation. As we said before in the previous lecture, we speak about the resuming ovulation and menstruation in non-nursing or non-lactating mother within 7 to 9 weeks after childbirth. But regarding to the lactating mother, menstruation usually reappear not earlier than 3 to 4 months and sometimes as late as 24 months، يعني حوالي سنتين بتجيلهاش البريود. Regarding to postnatal exercise and also regarding hygiene, rest and sleep and nutrition. Also the other healthy education topics and the counseling that the midwife give to the mother is the care of baby, which includes hygiene, prevention of infection, feeding and giving him love and sense of security. Also family planning method for spacing of pregnancy. Either stress the importance of postpartum examination, visit for follow-up to assess evolution and general health and well-being of the mother before discharge, and also the danger signs during postpartum period. After speaking of the care of mother, we will speak about the care of newborn infant. It is including the observing the general condition of the infant and checking the cord condition, checking the infant's physical needs, cleanliness, feeding, warm sleep and protection from an unsuitable environment. Also checking psychological need and bonding and the attachment between the infant and her or his mother. Carrying out partial or complete bath to ensure cleanliness and comfort of the infant. Also finally use of proper clothing to keep the infant warm, as the hypothermia has a great complication on the newborn infant. After early and late need of the mother, we speak about the minor discomfort during this postpartum period. It is an important topic. They are minor complaints أو شكاوي felt by the parturient or laboring woman during this postpartum period. Simple intervention measures are needed to alleviate this complaint. ودوت الفرق بينها وبين الكومبليكيشن اوف البوستبارتم بيريود. يعني ايه؟ يعني دلوقتي الماينر ديسكمفورت او المتاعب البسيطه دي ممكن عن طريق بعض النيرسينج ميجرز او الانترفنشن ممكن ان انا اعمل لها اليفيشن او اقللها او اضيعها، انما الكومبليكيشن لازم لها انترفنشن ثانيه مختلفه خالص. The first important one in minor discomfort is after pain. It is a spasmodic colicky pain in the lower abdomen during the early postpartum days due to vigorous contraction of the uterus. يعني ايه الكلام دوت؟ انا في عندي حاجه اسمها after pain اللي هي contraction of the uterus، بتبقى vigorous contraction او severe contraction of the uterus to return to the pre-pregnancy size and condition. فطبعا السيده بتحس بايه؟ spasmodic او colicky pain which is called after pain. It is more common and more severe in multiparous women due to weakness of the muscle tone as a result of multiple pregnancy and labor. Condition which increase the intra-abdominal pressure بردك بيزيد فيها الافter pain such as polyhydramnios or increase the amniotic fluid and the multiple pregnancy or twins, large size infant. Predisposing factors that increase after pain in some conditions such as presence of blood clots, pieces or retained membranes or placental tissue. It is a trial from the uterus to expel the inside content that is increase the uterine contraction. Also in breastfeeding that increase after pain by increase the release of oxytocin that has a contractility effect of the uterine muscle that increase after pain or uterine muscle contraction. The nursing management to decrease the after pain, simple uterine massage, reassurance and simple explanation of the cause for the woman, proper positioning in prone and sitting position, offering warm drinks, that relaxation of that has a relaxing effect on the muscles, mild sedative as doctor ordered before feeding, avoid a full bladder as a full bladder prevent or inhibit or decrease the contraction of the uterus, so that it is important to evacuate the bladder. Finally, encourage the abdominal and pelvic floor muscle exercise. The second minor discomfort after pain is urinary retention. It is the inability to excrete urine. The urine is accumulated within the urinary bladder. This condition is a common complaint